Emily here with Senior Helpers, and today we're joined by Kate again with Ability Home Health Care. And Kate's here to talk to us a little bit because today, or this month, is National Physical Therapy Month. And so Kate will be talking to us about physical therapy, about what it is and what it can do for you and why it's so, so important. So thank you for joining us, Kate.
Absolutely. Thank you, Emily and Senior Helpers, for including me in your Wellness Week. I know I've told you before, but I'll tell you again, I really appreciate being included and having the opportunity to share about different health things, especially as it relates to seniors. And of course, one of the most important things for seniors is physical therapy. And I'm so excited that the month of October is Physical Therapy Month because it allows me to just share more about physical therapy, and it gives everybody the opportunity to learn more. So what is physical therapy? Physical therapy actually helps people get back to their full strength and movement following an illness or injury. And physical therapists are your movement experts. So they're going to help people maximize their quality of life through prescribed exercise, hands-on care, and education. So when would somebody actually need it? Why would I need it? So physical therapy is generally something that people would need following an injury, a surgery, or hospitalization. Maybe they have a disability or other health condition that need treatment. Physical therapists care for people too who are actually just wanting to become healthier to prevent future issues. So really anytime you're noticing a decline, then and getting around, it's a good time to get physical therapy involved. Sometimes, you know, as people get older, they think, well, it's just normal to lose, you know, my function. It's normal to start falling. But that's actually not true. It's not something that you just have to live with. And sometimes people are just starting to rely on other things like furniture. People will a lot of the times use their furniture. We call it furniture walking, where they're constantly kind of grabbing onto furniture. So they're not necessarily identifying, oh, I need physical therapy. They're just changing the way that they move. And maybe it's more difficult to get to the mailbox. Like it used to be easy to get to the mailbox, or it used to be easy to grab the things on the bottom shelf, or get to the bathroom quickly, any of those things. So anytime somebody's noticing that decline, it's a good time to get physical therapy involved. But it's something that you would discuss with your primary care provider, whether that be your physician, with a nurse practitioner, a PA, whoever it is that you see regularly for your health. Generally, they're going to actually prescribe it. So it's actually a written order, just like a medication. And usually they're going to, again, recommend that following some sort of medical setback. But you can talk to your physician if you think it's something that might benefit you. Physical therapy is tailored to your specific situation. So just like going to your primary care doctor, your doctor's going to ask you a whole set of questions to kind of figure out what's going on. A physical therapist is going to provide that same approach, where they're going to meet with you, kind of talk to you about what's going on, identify what your specific situation is, and then obviously establish some goals specific for you. Maybe it's, I want to be able to get to the mailbox without having to stop and sit on my walker seat, for instance. Or, you know, I want to be able to get around my house without relying on my furniture to do so. A physical therapist will talk through that with you, and then they'll evaluate your functional status. So they're going to actually do a functional evaluation that they're trained to do, and they'll look at your strength, your mobility, range of motion, they'll look at your balance, and then they're going to come up with some specific exercises for you specifically to do at home. or in a gym. Physical therapy can be provided anywhere pretty much. But a lot of the times you're going to receive it in the hospital. You can receive it in home. That's what we do at Ability Home Healthcare. We provide therapy for people in the home setting. Once people have kind of graduated our program, or maybe they don't even need our program and they're out and about in the community, they might utilize an outpatient therapy clinic. Sometimes people will receive it in their workplace or in a nursing home or a senior living community. So there's a plethora of places that you would actually see a physical therapist, but it's very common if you're in the hospital, you're going to see a physical therapist. They're going to kind of evaluate how you're moving around, which will help them kind of direct where you might go and what would be the best plan for you. Sometimes you're going to go to an acute rehabilitation or subacute rehabilitation center to receive services following a hospitalization. And maybe following that rehabilitation stay, then maybe you would come home with medical home health. And then after medical home health, you may receive outpatient services. So it's really just whatever it takes to get you back to your optimal place where you were prior to blank, whatever it was, whether that be a surgery or that medical setback. But they're going to help you walk and sit and stand and climb stairs and manage your pain and do everything so that you can, like I said, live a great life. Physical therapists are different than personal trainers or fitness trainers that you would see at a gym. Physical therapists are clinicians who have earned a degree from a commission on accreditation in physical therapy program and pass a state licensure program. And just like a physician, they must, in order to maintain their licensure, do ongoing education so that they're always staying on top of things as they expand in their field. Some physical therapists are specialists, just like doctors are specialists. You instead of just seeing your regular doctor, you will maybe see a cardiologist or an oncologist or an orthopedic physician. Just like physicians providing specialty care, there are physical therapists who will get a clinical specialty by, instead of just studying physical therapy on a broad level, they'll go kind of into a greater depth into a specific area, like pediatrics or geriatrics or neurology. At Ability Home Healthcare, we focus a lot on neurological conditions and orthopedic conditions, and obviously with a lot of geriatric programming. So we see mostly older people, but we do provide physical therapy to pediatric patients as well. It just kind of depends on what's going on. But if you guys have questions about physical therapy, or you think you might benefit from it, or somebody you know might benefit from it, just give me a call. I'm happy to answer any questions that you have. I'm happy to connect you with our owner at Ability Home Healthcare, who happens to be a doctor of physical therapy. And we'll see what we can do to get you guys back on your feet and walking around and living your best life.
Great. Thank you so much, Kate. Yeah, so if anyone's needing some in-home care with physical therapy, definitely give Ability Home Healthcare a call because they'll be able to help you out. And then in the meantime, if you're having trouble walking around, if you're having trouble doing those activities of daily living, we can also help you out until you get better. Ability Home Healthcare and Senior Helpers works together to make sure that you're living your best life and getting the best outcome out of physical therapy. All right, so thanks so much, Kate, for joining us, and thanks for everyone who joined us too. Have a great day.
Thanks, everybody.